Hi, I'm Dr. Steve Grinstead, author of the book Managing Pain and Coexisting Disorders and developer of the Addiction-Free Pain Management System. Today I want to talk about what do you do when someone has chronic pain and coexisting psychological disorders, especially addiction. This is a very challenging problem. Some people get in trouble with pain medication, other people get in trouble with not using appropriate pain management activities. There's many different things that can happen to sabotage effective chronic pain management. Over the years, what I've discovered is a lot of people that get in trouble do so because they form an unhealthy relationship with pain medication. A lot of times people are using medication that was developed for acute pain management for chronic pain conditions. The opiates work really well for acute pain. As a matter of fact, if I went out and got in a car accident and got rushed to the hospital, I would definitely want them to use opiates if my injuries were serious enough. Even though I'm in recovery for over 33 years from alcohol and pain pills, I would still want to have something. However, I would also want to make sure I notified my support team that I needed an exit plan because I've been exposed to psychoactive substances. Many people living with chronic pain and taking opiates for a number of years will develop a condition called opiate-induced hyperalgesia. And this is where there's a hypersensitivity to the pain system. One of the things I suggest when I train treatment professionals for this population is we need to break it into phases and stages, phases of pain management and stages of addiction treatment. To do that, we need to use an integrated multidisciplinary team to make sure that we do a complete assessment. Let's start unilaterally with the pain. So we want to take a look and see how much of the pain is physiological, how much is psychological. We need to look at the medications. Is the person using their medications appropriate? Are there any red flags? Does the person have a family history or personal history of addiction? We need to look at all of that because that's going to help determine what the treatment plan is. Then we need to help people see that we need to use a team approach for their pain management, more than just medication. There's three core components I talk about. One is appropriate, effective medication and medical interventions. And if the person has an addiction risk or addiction history, we want to use an addiction medicine specialist to help us develop this treatment plan. The second part is to develop a plan to help the person identify and manage the psychological and emotional components of the pain. And then the third part of the plan is to develop non-medication-based, non-pharmacological-based interventions for the pain. We need to teach them how to identify and manage pain flare-ups. Now, when we talk about the addiction, we need to do a parallel process. We need to see, is the person experiencing substance use disorder, either abuse, pseudo-addiction, or addiction? And no matter whether it's pseudo-addiction or addiction, my treatment plan is identical because if people stay at the pseudo-addiction level, which is undertreated or mismanaged chronic pain, they're at high risk for crossing over into addiction. So the first step is to do an assessment and see where the person's at with the substance use disorder. The second piece is then to take a look at what is the level of awareness about this being a problem for the person. Some people are in total denial, some people are in partial denial. Some people have no resistance to looking at this, some people have extreme resistance. So the earlier stages we need to do this. If you're watching this video on YouTube and you want to learn more about the phases and stages of treating someone with chronic pain and coexisting addictive disorders, please go to the link below and check out my professional blog. I've written a whole book on this. It's called Managing Pain and Coexisting Disorders using the Addiction-Free Pain Management System that you can also find a link to below this blog on YouTube. I want to help people achieve effective chronic pain management and freedom from suffering. I believe that freedom from suffering is everyone's right, and it's also their responsibility. Thank you for listening, and let me know what you think about my professional blog. Thank you.